In syphilis, it may be in bridge of the nose, dimples on cheeks, nose down from or mouth down from. First one, bridge. Line is either straight and horizontal or a semicircular curve that stretches from one side of the bridge of the nose to the other. So in the first picture, it is a curved line, while in the second one, it is a straight line. So it will be at the bridge of the nose. So when the line is present on the bridge of the nose, it is considered in syphilis. It may be either curved or straight. Next one is dimples on cheeks. It is usually seen when a person smiles. So there would be dimples on the cheeks. It may be on both cheeks or it may be on one cheek. Both will be counted as 1 point. Like if it is on both cheeks, it is counted as 1 point. When it is on only one cheek, it is also counted as 1 point. Next one is nose down from. When the line arises from the nose, so beginning from the corner of the nose, these lines extend downward. It is also in syphilis. So the line is arising from the corner of the nose. In the first one, it is making an arc like a structure, while in the second one, it is quite straight. Both of these features are in syphilis. Third one is mouth down from. So mouth down from means the line is arising from the corner of the mouth. Begin at the corners of the mouth and extend downward at a slight angle towards the jaw. So when the line is arising from the corner of the mouth, it may be angled or it may be straight. In the first picture, we can see that the line is angled, while in the second picture, we can see that the line is straight. All these features are of syphilis. Lines on the bridge, lines on the cheeks as a dimple, lines from the nose or lines from the mouth. There is a one differentiating thing. In syphilis, the dimples are on the cheeks, while in psychosis, the dimple is on the chin, which is also called cleft chin. So when the dimple is on cheek, it is syphilis. When the dimple is on the chin, it is psychosis. So lines in Psora, it may be on forehead, eyes, below the eyes between two eyes, on the cheek as multiple fine lines. In psychosis, eyes, one line between the eyes, mouth, around the mouth. In syphilis, it may be at the bridge as a horizontal line, it may be straight or curved. On cheeks, it looks like dimples or lines. Nose, from the nose, mouth, from the corner of the mouth. Asymmetry. Asymmetry is a feature of syphilis. So asymmetry, when one facial feature has a different shape and size or position than its counterpart. So when it is quite different to the opposite part, it is called asymmetry. Asymmetry is allocated from 4 features only. First one is eyes, second one is nose, third is mouth, and fourth is chin. Asymmetry exists in every person's face, which is quite normal. So when one asymmetrical feature is present, there would be no point given. When 2 or 3 asymmetry features can be seen, then it will get 1 point. When 4 or more than 4 asymmetrical features is present, it will get 2 points. So in syphilis, there is asymmetry of eyes, nose, mouth and chin. If it is 2 or 3 place on face, it get 1 point. If it is it is of 4 or more than 4 places, it is of 2 points. Skin. In Psora, there would be freckles on the skin. Freckles, these are numerous and cover most of the surface area of the face and easily noticeable. So these are small dots like structure on the surface of face and it can easily be noticeable. These are freckles, which is prominent in Psora, because Psora is all about skin diseases. So freckles. So in skin, this freckles is present in Psora, neither in psychosis nor in syphilis. Summary or the gist. So hairline In Psora, the hairline is widow's peak or M shape. In Sycosis, the hairline is straight, low, crowded. In Syphilis, the hairline is high or balding. Forehead. In Psora, the forehead is sloped 12 degree or greater than 12 degree. Sycosis, straight 11 degree or less than 11 degree or brow strong. In Syphilis, it is curved or indented. Bridge of nose. There is nothing mentioned about Psora, but bridge of the nose in Sycosis is full or straight, while in Syphilis it is indented. Eyes of Psora are downturned, close set, small, full lids. In Sycosis, it is large, exophthalmic. In Syphilis, it is upturned, wide set, deep set, recessed lids, or eyes indents. Nose. In Psora, there is bump on the nose, downturned, curved. In Sycosis, the nose is wide or ball-like. Cheeks. In Syphilis, prominent cheekbones, sunken cheeks. Mouth in Psora is small, while in Sycosis it is wide. Lips in Psora is thin, in Sycosis it is full, in Syphilis it is underlip. Smile is compact in Psora, full, large, gums are shown in Sycosis. Teeth in Psora is front two teeth prominent, in Sycosis the teeth is even, gaps between front teeth or multiple. In Syphilis, it is crooked over front two sharp pointed, cupped, overbite, underbite, inward. Chin sloped back, Sycosis, ball or cleft chin, Syphilis, defined or pointed. Ears in Psora, it is high, low, sloped. In Sycosis, it is turned out or turned in. In Syphilis, it is large or small. Lines of Psora are on forehead, eyes below, eyes, two lines between the eyes, cheeks, multiple fine lines. In Sycosis, one line between the eyes or around the mouth. Syphilis, bridge horizontal, cheeks, dimples or lines, nose down from, mouth down from. Asymmetry, eyes, nose, mouth and chin in Syphilis. 2 or 3 places on face will get 1 point. 4 places or more than 4 places it will get 2 points. Skin in Psora have freckles. Reference: the entire presentation is based on Grant Bentley Homeopathic Facial Analysis as in B.jain Publishers in the year 2020. Thank you for your time.